So now rhythmic movement. So till now we have studied about the primitive reflexes. So and we have studied that these primitive reflexes are basically nothing but these are the series of movements which every newborn does, and those movements are uncoordinated, and as the child grows and grows they become more and more sophisticated, become more and more coordinated, become more under the control of a person, as a result which are responsible for the maturity of the central nervous system, our limbic system and sensory system. So what are this exercises or how to integrate them is basically known by the term what we call as rhythmic movement therapy or RMTI. So these rhythmic movements are nothing. They are basically, we are trying to mimic those original movements which were present in a neonate during his birth period. Probably those movements were not smooth enough. So we will try to adapt those movements in our present life, whether we are 5 years, whether we are 8 years, 12 years, 20 years, doesn't matter. But the concept is we want to implement those previous movements of our birth in our present scenario so that they become more and more coordinated and ultimately help in maturation of the central nervous system. And why we do that? Because probably in those set of individuals, the initial movements when the person was as in his neonatal period, those movements might not have been gone from an uncoordinated to a coordinated. And that is the whole concept of this rhythmic movements therapy. So just a brief about the background and the history of these rhythmic movements. So these rhythmic movements first originated in Sweden in 1907, and this were basically originated by a person named Kirsten Lindy. Now, she was not a therapist, nothing. She was basically a photographer, and she was very interested in taking the photographs of the newborns when they are born just after. So she was very curious in his hobby in taking the photograph of the newborns which are delivered. So what he noticed that those movements were basically uncoordinated movements. So she just called these movements as rhythmic movement pedagogy. Pedagogy basically means where we refer to them as the newborns or the children. So in 1980s, Harold Blomberg, he was a psychiatrist, and he has a very famous book that is Rhythmic Movement Therapy. It's a very good book to read where he has mentioned about these rhythmic movements. And this person, he met Kirsten Linde, who was a photographer, and he was very impressed to see her that how these movements were very helpful for him also, because this Dr. Blomberg was having polio, and because of that he was having those movements were disturbed and he was not able to carry out those movements, definitely because of the polio. And when he adapted those movements which were being used by Kirsten Linde, he found it to be very useful. And even he tried these movements for his patients who were suffering from neurological disorders, behavioral issues in children, and he found them to be very useful in psychiatric patients as well as in neurodevelopmental disorders. And then in 2003, Maury Dempsey. Now, all the videos which I have shown you, the instructor there was that lady was Maury Dempsey, and she is the pioneer about these rhythmic movement therapy, and she's certified as a kinesiologist. And then she met Dr. Blomberg, and then she started this whole program of rhythmic movement therapy. So now this rhythmic movement therapy program, RMTI, with its headquarters in US, and she is the person who is being running behind this rhythmic movement and running this program all over the world. But the originated from this person, Kirsten Linde. So what are these rhythmic movements? So as I have told, rhythmic movements basically means we will try to adapt those previous movements of our birth, which should happen in every newborn, but because of any reasons which we have discussed, those movements don't go into a smooth coordinated manner. They remain just an uncoordinated manner. So it's basically a program which will try to replicate our earliest movements patterns. And why these earliest movement patterns are important? Because they are responsible for the formation of a vestibular function, sensory system, memory, learning, and behavior. Memory, learning, and behavior means the limbic system. Now, why it is important? As we have discussed, because initially when the child is born, the connections between the brain are not very good. That is, the connections or the neuronal connections, what we call as synapse, are not good. So as a result, because these movements are uncoordinated, suppose one is going there, one is going there, so the signals are not going from in a coordinated manner from one part of the brain to the other. But when the child grows better and better, those naturally, it's a God gift. So those movements naturally become more and more coordinated. So as a result, more and more signals get dispersed to different parts of the body and the brain. So as a result, our neuronal connections becomes better. Now, this is the peculiarity, and this is what we call as neuroplasticity of the brain. Now, why I'm telling that even an 18-year-old child, 40-year-old person can work with these rhythmic movements and can make his memory, intelligence, functioning even better. Why? Because of this concept of neuroplasticity. The neuronal connections between the brain can be happen at any stage of life. It's not that once the neural connections are formed, you cannot progress further. You can always modify the connections. You can always make the connections better and better. So this is the concept. More the rhythmic movements, better the rhythmic movements, better coordinated these movements, better are the connections. And these better the connections, better will be the maturity of our brain, better will be the functioning of the limbic system, and better will be the functioning of the sensory system. So this is the whole basis and the concept of doing rhythmic movements to make synapses and neuronal connections more and more better and mature. And once that happens, we will able to see improvements in our overall progress of the child. So what are these rhythmic movements? Movements are essential for the development of nervous system. We know that, we have studied that. And at the birth, the neuronal connections are very, very weak or minimal. We have also learned about this. And as the infant moves and experiences the world, he creates a lot of bonding from the different areas, from the sensory exposure. So those exposures, those movements causes more and more neuronal connections and helps in the formation of myelin sheath. Now, what is myelin sheath? Myelin sheath is just like you can imagine it's a conductor. Like water is a very good conductor of electricity. Similarly, myelin sheath or myelin is a very good conductor of transmission of signals. A cell, suppose a person who is not having a myelin sheath and a neuronal cell which is having a myelin sheath, the connections will be much, much better and faster in a brain cell who is having a myelin sheath, because myelin acts as a good conductor of signal, just like water. If we place water and allow the current to flow, it will be flow faster in water area than compared to a non-water area. Similar is the function of myelin sheath. So myelin formation will become more and more better as the person or as the newborn makes lot of different types of movements from an uncoordinated to the coordinated. So the more opportunities an infant is given to practice and experience a wide range of sensory exposure like flow time, which I was discussing in the webinar one, should be both on the tummy as well as in the back. We should play them lot of exposure through hugging, through rocking. All those movements are very, very important because it gives them the vestibular input, it gives them the sensory input, it gives them the tactile input. But because of a present scenario, we might see that the lifestyle of us is so busy that sometimes we may not be able to give children that much of time, and most of the time we may be putting them in rocking chair or chairs which are tightening through the belts through the waist. So as a result, the necks will always be remain like flexed like this. Now, because of this flexion of the neck, it causes a lot of problem. Why? We'll be seeing in the future slide. So what are rhythmic movements? Rhythmic movements we have discussed is just the replica of the initial movements of the newborn. Why we want to perform these movements? Because they help in integration of the reflexes, the most important function of these. They help in forming the neuronal pathways. They help in creating postural foundation, that is lifelong reflexes, by integrating the primitive reflexes and stimulate the senses. So this is all the most important 4 functions of these movements, and they can be helpful. And if we are able to achieve these things, many of our things can be resolved to some extent in our kids. Now, what is the importance of these rhythmic movements? First and foremost important is head control. Now, I was telling you about this invent of car seats where the child is being flexed and his neck is always moving. Why it is not good? It is not good because head control is the first and foremost thing which a child attains by the age of 3 to 4 months. And that head control is very, very much important because only after that, he is able to explore the world. He is able to see the sensory things around. He is able to feel the world, the awareness. Because before the period of 2 to 3 months, if you pull the child like this to the shoulders, the head will lag down like this. He won't be in his control. But once he is able to attain the control, he will be moving his head like this. Though initially he may not be strong enough because TLR may be present, but at least with the help of arms and support of neck, he may be able to explore the world. So by keeping the child on the car seat, we are basically hampering the child to expose the world through the sensory exposure. I hope I have made myself clear in this. Now, this exposure to the surrounding world and sensory exposure is very, very important because it helps in the development of near senses like vestibular sense, proprioceptive, tactile. Now, interoceptive is the eighth sense, which basically gives you a sense, internal sense of feeling that I am hungry, I do want to eat more. It means like something, sometimes we might see that the parents might complain that he keeps on eating continuously again and again in spite he's full, but he will be eating. He doesn't know that my stomach is full, I don't want to eat more. That is what we call as interoceptive. That is the internal sensation of a body is not strong enough to give an indication that I don't want to eat now more, otherwise I will vomit out. So that is the thing. So this neck control is very, very much important for our near senses, vestibular, proprioceptive, tactile, because if these senses are strong enough, the rest of the far senses, which are vision, taste, smell, and hearing, will automatically become better. Because these near senses are very, very important, and they start forming in the intrauterine period. Intrauterine period means when the child is still inside the uterus. Now imagine, when the child is born, when the child inside the uterus, there might be a lot of complications which we have discussed previously. Either maybe epigenetics or other factors might be there, which may be affecting the child and the mother. As a result, the FPR or the Moros in the uterus, it will be the FPR. If FPR remains activated continuously, there will be a lot of stress. If that lot of stress is there, that means it may not integrate. And if it is not integrated, then definitely your near senses like vestibular, proprioceptive, tactile will be affected. If those are affected, the far senses might also be affected. So this is the importance of most important thing, head control and other primitive movements. So what are these rhythmic movements? Rhythmic movements are innate movements, means we are basically doing the replica of the initial neonatal movements that are responsible for foundation of the posture because of the postural reflexes, maturing of the vestibular system, overall neuronal development because of the formation of more and more neuronal connections by the concept of neuroplasticity of brain, sensory processing, emotions and behavior by the development of strong mature limbic system. So this is the most important functions of the rhythmic movements, and that is why we want to do these rhythmic movements in kids. Now coming to rhythmic movements. Now rhythmic movements are basically of two types. Pre-birth movements. Pre-birth movement means there are certain movements. Till now, we have seen that after the child is born, we do some sorts of movements like pedaling, kicking, joining hands, moving out. So those are movements. Similarly, when the child is inside the uterus, he also do some sort of movements which are known as pre-birth movements. Now, those movements might be affected or might not occur because if the stress is too much, where the FPR may not be integrated or the intrauterine stress is very, very high, maybe infections, stress, or whatever may be the reasons. So now you can imagine that this concept of rhythmic movement starts right from the period when the mother conceives or maybe by the age of 5 weeks or so. So it's not only that after the child is born, the problems appears. The problem becomes visible after that, but it is basically has occurred right before the child is born. So the concept of pre-birth movements and the infant movement means which occur after birth. Now these two movements can be performed through rhythmic movement therapy, either through active movements or through passive movements. Active movements means where a person can perform these movements without the help of other. Means he will himself be doing the active movements by himself. But here in today's workshop, we'll be focusing on passive movements because here we are dealing with kids who are on the spectrum and maybe development delay or other neurodevelopmental issues, but we are dealing with kids. So we will be focusing on passive movements, means the caregiver or the mother or the instructor will be doing the movements for the child. So replicating the earliest movement patterns helps in building a strong central nervous system. It helps in formation of the vestibular function, sensory processing, memory, behavior, emotions, and learning, means limbic system. I am revising this again and again, these three things, because these are very, very important and they form the foundation of the maturation of the connections between the different parts of the brain. Movement is essential for the development of nervous system. That is very, very much clear now, because if we don't move, our connections will not be formed. And this is true even at any particular age. That is why it is That is why it is advised to do a lot of yoga exercises on routine basis. Otherwise, your brain, your functioning will become dull, because your neuronal connections, your concepts, your different functioning of the brains will not be mature. The connection might become dull, because it's not like that. If one it is formed, they will remain lifelong. If because of your lifestyle, because you have a habit, because of your sedentary lifestyle, or maybe due to any reasons, the connections may also get weaker. That is what where we call as neuroplasticity. We can always improve them. They can also always deteriorate. So using the movements to retain the system and reset the foundation. The more refined we are, the more specialization or the function of the brain are able to form. Means to say, when we are performing the rhythmic movements, it's not only important that you do the rhythmic movement. The concept of doing the rhythmic movements is very, very important. It should be done in a very systematic and refined way, because movement doesn't mean you do movements like this or like this. No, movements here means you have to be very refined. It should be very focused, specialized, because the more specialized, more refined, and more organized the movements are, the better organized your connections of the brain will be, and better will be the maturation of the. So that is why the concept is it should be refined, it should be specialized, and it should be exactly mimicking your replica of the infant. So when we do this rhythmic movement therapy, RMTI stand for Rhythmic Movement Therapy International. So when we do these rhythmic movements, the concept of exactness is very important, because movements is not important. Anybody can do the movements. Either he can move like this throughout the day. We are doing the movements. Either we are running, we are going, we are doing something or the other. So here the concept is very important, is exactness. Now, what is that exactness? What is that characteristic? That is very important. So these are the qualities of exact movements, or in fact, I would say these are the qualities of rhythmic movements. You can take a snapshot of this. We'll be sharing the slides and the literature, but if you want for the moment, you can take it. So the qualities of rhythmic movements are very, very important. It should be rhythmical. It should be smooth. It should be effortless. It should be easy. It should be coordinated. It should be symmetrical. It should be flow and connection. There should not be any accessory movements, no compensation, no holding of breaths or any other parts. Now, for example, I give you a simple example. This is my hand. Now, I'm doing this movement. Do you feel, are they coordinated? Are they smooth? My other parts of the body are also moving. See, my shoulder is also moving. My head is also moving. So this is what we call the movements are not exact. Exactness of the movement means, this is an example I'm giving just to make us better understand when we come to our future movements, which are actually rhythmic movements. So now see these movements. Now these movements compared to the previous movements are more refined, more smooth, and there is no tension or expression on my face which is making me feel or making you feel that I'm doing some effort in doing these movements. So they are just going like this as though I'm performing them involuntarily, without any effort, without anything, and these movements are going just smooth and coordinated. It's just like when you drink a sip of water or a half glass of water, you don't feel any effort that something is going on. It just goes automatically in your mouth and through the esophagus and stomach and etc. So that sort of movement should be there. There should not be any effort. There should not be any unnecessary movements of other part of the body. So that is the concept of rhythmic movements. And this concept of rhythmic movement, these characteristics of movements cannot come on a single day. It will take time. Even for me as a professional, as a parent, it takes time. It cannot come immediately if I do on a child and the next day I will get that effort. No, it may take 1 week, it may take 2 weeks, it may take months. So as much movements you will do, the better you will get the confidence in doing that. Now, how much to be done, how much should not be done, that we will discuss in future. So this is the main concept. Whenever we do the movement, these 7 to 8 points always have to be kept in mind. Initially, we'll be required to keep them in mind, but once we are confident enough, those things will just automatically come when we will perform the movements on our kids. So An important concept of this rhythmic movement is less is more. So less is more. Why? Because the concept here, we are stressing on the rhythmicity, we are stressing on the effortless, we are stressing on the smooth, we are stressing on the exactness. So even if you do, don't aim for a target of doing 20 movements in a day. You just aim for doing target of 2 movements in a day, but that 2 movements should have all those 8 characteristics. Then you will be able to achieve your target. If you attain for the concept of doing more movements, but you forget that concept of rhythmicity and those characteristics, we will not be able to attain our target. So that is why here the concept is less is more. So always focus on those things. Start with just 1 or 2 movements in a day, but try to capture those at least 80% of those characteristics in each of your movement. If you are able to do that, then we'll be on a right track. If not, then the movements will actually, it will not be useful unless and until we do those things of characteristics. Now, doing as a parent or doing as a therapist. See, even if you see this concept of rhythmic movement therapy can go, there is no end how much you can do. You might get the results even after 1 month, or maybe you may get the results of 4 months or 6 months. So this is basically a long-term process. You can do, you just involve these movements in your day-to-day life and do it on daily basis. Assume that you are doing a yoga. So it's nothing, any therapy sort, it's just a normal routine exercises, which you as a parent can always imbibe in your day-to-day routine activities. The child will also feel comfortable, and even you will also notice the changes. Why I'm telling you this? Because for this thing, you don't have to run to a therapist to do those activities. Probably you might do it for 6 months, 7 months. Then after that, ultimately, if you are not doing those things, probably after some time, those reflexes might appear again. So that is why involved in a routine to day-to-day activities. And once a period you are able to do that, you will become confident enough in doing those activities. So less is more is very important. So if the body is disorganized, our emotions are also likely to be disorganized. And our thoughts will also most probably be disorganized. Now, opposite can also be. Now, one thing I would like to tell you here, when we do these movements with our kids, because we know that it's very clear that the limbic system, the neuronal connections are not very strong in our kids. Because of those issues, they are landing up in neurodiversity spectrum. Now, as a result, when you will start doing these movements, it will be very difficult for you, because the child may lock his knees, he may be fidgeting here and there. Because why is doing that? It is actually practically it is true. He will do that because his body is disorganized. And the body is disorganized. That is why when you are doing those movements, he'll be either looking here and there, he'll be fidgeting, he'll be moving his hand like this, he'll be flexing, he will be making sounds, because his body is disorganized. And because his body is disorganized, his organization, his concepts, his thinking is disorganized. Now you are here working in order to make the things organized. So when you are doing this, initially you are doing those movements against his resistance, against the disorganization. So it will be tough. That is why I'm telling less is more. Don't run for the number of movements, run for the exactness of the movement. And never work on the child, work with the movements. If you aim at targeting that I have to work on him and I have to complete this target by this month, then we are aiming with the wrong concept. Aim that I have to perform the movements with exact characteristic, whether I'm doing it 1 time or 2 times. Then probably his that fidgetiness, his relaxation, he will become more and more cooperative with you once you do those movements on regular basis. So primitive reflexes, if they are retained, definitely the movements will be unjerky, they'll be asymmetrical, and he will be jerky and uncoordinated. That is why I'm telling, we know that primitive reflexes are retained in our kids. So we cannot expect a child that when you start with the rhythmic movements, within a week or within 3 to 4 days, he will be listening to you. Forget about listening, he'll be doing those movements effortlessly and smoothly. No, it will not be possible. Although you will be trying to do those movements effortlessly and smoothly, but the resistance of the child, in terms of, as I've told, he either may lock his knees, he may tense his muscles, he may resist. Why? Because reflexes are retained. So it's a usual result which we will attain initially in our case. So that is why go slowly, smooth. So if the primitive reflexes are retained, definitely the movements will be affected. It will be jerky and coordinated. And that is why in most of the routine activities, they are fidgety, they are very clumsy in doing the activities, especially the fine motor activities, the axial tone or the tone, body posture is very, very weak. All those things indicate because the primitive reflexes are retained. Coordination is poor because cerebellum. Cerebellum means the hind portion, the hind brain, the last portion of the brain, which is very, very important for doing the coordination activities like midline activities or hand-eye movements. So those coordination activities are basically governed by the hind brain. And we have seen that if primitive reflexes are retained, the connections are very, very. Then poor sensory processing. So then we have to work with the person, not other person. This is what exactly I was telling you 2 minutes back, that don't think I have to work on him. Think that I have to work with the person as a buddy, as a friend. So start with where they are and not where we think they should not. That is what I was telling again, that work with the child where he is present. Why I'm telling this again and again, because a mother may say that my child is able to perform those movements and I'm confident enough within a 3 to 4 days he has attained and he is now giving me a cooperation. Probably he might not be, his primitive reflexes may not be retained that much, or he may not be in that much severe spectrum. But another mother complained that since last 1 month I'm doing this exercise, I'm fed up, I'm not able to attain that exactness, he's not cooperating with me and it's very, very difficult. So it doesn't mean that we have to get disheartened or we should lose hope. It just means that the child here is on a different spectrum or degree of spectrum compared to the previous child. So that is why we have to judge our kid, and we should never compare our kid with the other kid, because it will not at all be possible. Because it's a very famous saying, because when we meet a child with a spectrum, we meet another child with a spectrum. No two children on the spectrum will ever be same. That is why there is no rational treatment or approach has been made for any kid on the spectrum. Every kid on the spectrum will have a different approach to treat. I mean, to modify. Treatment is a wrong word, because we cannot treat, to modify his symptoms. So that is what the concept is. Work with the person, not on the person, and never aim with getting a target to achieve that. So in the beginning, it may be only possible to maintain this rhythmic exactness only for a few seconds. So mean to say, if you are doing a movement with a child, we'll be seeing what movements. Suppose if you do a movement with your child, he may give you that exactness for just 1 to 2 seconds, and then he may shrug his shoulder like this, so that movement will be break. Obviously, if it's just does like this, that whole effort and everything will go. So that is why I'm telling that exactness you may attain even for just 1 second. That is also very, very sufficient in the initial first 2 to 3 days or maybe 1 week, depending upon the ability and the severity of the spectrum of the child. So that is why exactness is important, not the duration. Now, to begin these exercises, the first, now we are coming to our exercise or the passive exercise, how we have to perform those exercises. Now, we are performing the exercises on our kids. So the first thing what they have to do, we have to give them a good glass of water, a good amount of water. So it will be just 1 glass of water is sufficient for them. Now, what is the concept? As I've told, water is a good conductor of electricity. So when we drink water, our brain is also just like a wiring system, and the neurons, the signals which are going, they are just like an electrical system. So we are giving this water to improve the hydration and to improve the conductivity of our brain cells. So that is why, so that we can perform better and we can do those exercises in a very better and more efficient way. So whenever we perform those exercises, first and foremost is we have to make the child drink a glass of water. Depending upon how much he can drink, so that glass of water has to be drink for doing hydration. Now, second thing what you have to do, now this is what we call as side to side twitching. Now the purpose of this twitching is because these K27 are the points. And what are these points? Now this is the clavicle bone where it ends in the midline. You have to touch here, one here and the one on the left. So right and the left, these are the 2 collar bones of the clavicle bones. Where they end in the midline, you have to keep your points there, and just with the thumb and the index finger, you have to just rub them like this. Just rub them like this. Now this you have to rub on your kids. The kid will not be able to rub, so you have to rub them. This is the collar bone where it is just ending in the midline. That is 1 point and of the left. So these are called K27. Now these are just like some points which will basically help in inducing the conduction of water and electrical signals in a better way. These are some considered to be, by their concept, pressure points which will help in improving the conduction of signals in a better way. So this is one. Now, how much time you have to give? You can just perform it 1 to 2 minutes, that are sufficient, or maybe 1 to 2 minutes, depending upon the ability, tolerability of the child. And depending upon the glass, there is no fixed quantity. 1 glass of water is sufficient. And then depending upon the child, he might drink 250 ml, or he might drink half a glass, depending upon how much he can drink, or even just 100 ml. So 1 glass may probably contain 150 ml around, so that is sufficient. Now then this is known as side to side switching, K27 points. Then you have switching top bottom and front back. In top bottom, what you are doing, you are keeping your left hand on the navel, and the right hand, whatever hand, either you can use it left or right, one hand should be on the navel, and the upper hand, they should be on the lips. You have to rub your upper and lower lips like this. Now this is the purpose. Again, this purpose is to improve the conduction of the signals better, because when it is just like you are giving a warm up, when we do exercises, we give warm up. So here, when we are doing this rhythmic movements means we are improving the signals of the brain. So first we had a glass of water to improve the hydration conductivity, and these are considered to be warm up exercises to improve the hydration and give them better signals to different parts of the neuronal brains, neuronal cells. So this other thing, what you can do is front to back switching. Front hand should be on the navel. The back hand should be on the coccyx bone, just below the lower, the lower back. You will feel just above the hip bone. There will be a small point, coccyx bone. So you just have to keep your point there and rub the points. Just like this, you have to rub, just like the lady which is doing. So over the navel, one hand, and simultaneously up the other back. So this is, suppose, my hand on the navel, and this is my hand on the back. So you just have to rub like this on those points, pressure points. So again, you can do this 1 to 2 minutes. Then you have,
it will be in circular motion.
Yeah, it will be in a circular motion. It will be in a circular motion.
Thank you.
Okay. Then you come on to the central meridian energy. Now, what is this they are doing? They are basically, the concept is the energy flows down from up. This is the arrow which they are showing. So that is why, and our aim is also to improve the neuronal connections, the brain. So by doing this exercises, I will show how they have to do that. We will be able to flow a positive energy to the brain. And that is whole the concept of these rhythmic movements, to improve the brain functions, to improve the brain connections. So here what they have to do, you have to just finish tracing with it, trace the hand up and down front of the body for a few minutes, finish tracing it with the direction of this energy flow. So just you have to like this. This hand will be like this hand will be like this. I will show you in the video, it will become more clear. You can do it 3 to 5 times, but here remember, you don't have to touch your body. In the previous exercises, switching which we have done, you are touching your body. Here, this is the central meridian, the direction which you are doing. You have to just move your hand like this at the below portion, that is at the navel, and here at the mouth. You just have to keep it at the level of the navel and the mouth, and just move your hands like this in the direction from up and down. I will show in the video. So you have to do it 3 to 5 times. Remember, you are not touching your body. So these are the things which we have done, as I was telling you. So this is before starting with the movements, we have to do these warm-ups, whatever you can say, or hydration exercises. Now I will show in the video how we have to do those exercises.
Sir, sorry.
Yeah, please.
Can you please explain the K27 slide again? I didn't understand which part.
Okay.
Thank you.
I'll do one thing. I'll show you in the video. It will become more clear. If still you are not able to understand, I'll explain you.
Okay, thank you, sir.
Just give me 2 minutes, please. I think they are. Just give me 2 minutes. Yeah, actually, I will show these videos. Somehow they are deleted, or somehow they are not moving now. They are not. The video is not showing. I will show you at the end of this webinar. I will give you those videos again. Still, if you have any doubt, we will discuss on that. I will show after this completion of this webinar or the workshop, I will share you those videos again, especially this side-to-side switching and those columns. Now, I will explain this K27 again. What is basically the K27? Now, these are the collarbones, the two collarbones which are there, which we all have. Now, in the middle, where they finish. Now, this is the right collarbone, this is the left collarbone. Where they get finished, this tip where they get over, this is the right and the left K27 points. Everyone can feel their collarbones and feel that point. Everyone are able to localize that point?
Yes, sir.
Yeah. So this is the point, and from the thumb and the index finger, you have to keep the point here. Now, when you keep this point here, you have to just rub it like this, that point. So keeping here, I'm just rubbing my point like this, just in a circular fashion. So you have to do it for 1 to 2 minutes. This is the point. Just keep the thumb at one side and index finger on the other side, and just you have to rotate it in a circular fashion. So this is the K27 points which we have to do. This again, that is the upper rubbing and the navel hand. This is the back, the coccyx, the lower back. We will feel just above the hip. There will be a coccyx, the point hip bone. We have to just feel that point, and the front hand should be at the navel. This action, how you have to do, suppose this is suppose I'm doing this movement from up and down. So this is my upper hand, this is my lower hand. This is, imagine this hand as at my navel, and this hand is my head. So you have to do this, bring hand down, this up, bring this down, this up, this hand up, this hand up, this hand up, this hand up. So it should not be like this. It should be in a circular fashion, circular fashion. So you are basically, what you are doing, you are bringing this energy from down to up. So this is, imagine this is my hand which is down. So I'm moving my hand like this. Now I'm moving my hand like this. I'm moving my hand like this. Then I'm moving my hand like this. I'm not touching it. So you have to bring your hand from down to up in a circular fashion. It should not be like this. Should not be like this. It should be in a circular fashion, like this. So every movement we are doing in a circular fashion. So bringing the energy, positive energy from up to the brain. So it should be done for 3 to 5 times. So now coming to so before the birth, fetus gets stimulation from his own reflexes. As I was telling you about the pre-birth movements, which are very, very important. Now, those pre-birth movements are important, and those movements, pre-birth movement, the child performs or the fetus performs in the birth, it gets from his own reflexes, that is the FPR and etc., and from the mother respiration, heartbeat, digestion, and now why this mother movements are important? Because if mother movements are affected, or if mother's respiration, heartbeat, digestion is affected. Now suppose you are having a very high infection, so your respiratory rate, सांस लेने की जो क्षमता होती है, रीडिंग होती है, बढ़ जाएगी. हमारी हार्ट बीट, अगर हमको फीवर तेज आ रहा है, that will also increase. If we are taking lot of antibiotics, our digestion will get disturbed. Now if those things get disturbed, it will affect the child movements. Now if those child movements are affected, what we call as pre-birth movements, they will be affected. So if those pre-birth movements are affected, the connections will also be affected in the child in future. So that might possibility, the probability of landing up in neurodevelopmental delays might increase. So this is the concept of pre-birth movements and how it is influenced by the fetus, by the epigenetics, by the surrounding factors, and by the movements of the mother and the mother's medical status. So rhythmic movement patterns before birth matters a lot because these rhythmic movements of mother allow the child to brain and to develop connections between different portions of the brain. So that is why it is very, very important that the mother should take a very good diet. His pregnancy should go just like, I would say it should go extraordinary, or whatever we can say. It should be very, very smooth without any complications, without any stress. In fact, most important is stress because if the stress is there, that stress will fall up into the fetus. And if that stress is fall up into the fetus, the FPR will get aggravated or it may remain persistent because the child may not feel safe. So he will always remain in a state of isolation and protection. So that is the importance of these pre-birth movements. Now this is the practical application where we are doing these movements. So this slide I have, it's a very busy slide, but I have given you because it will be shared to you as your study material. So these movements have been clearly demonstrated how we have to do. So since now till now we have studied the pre-birth movements and the movements after birth. Now pre-birth movements are related to the movements which are there in the uterus. And if these birth movements are affected, that means our FPR will be affected. FPR is persistent means Moro will not come. And in majority of the kids who are on the spectrum, FPR and Moro will always be active. Definitely, that is for sure. The degree of activity may not be there. Some may be just mild active, may not be fully integrated, but yes, FPR and Moro will always be present. Why? Because of the observation we see on our kids. Anxiety issues, low self-confidence, not able to take proper decisions, anxiety issues, social anxiety, which is present in 90 to 95% of our kids who are on the spectrum. I'm not talking about the severity. I'm just talking it is present or not. So that is why it is noteworthy to remember that whenever we do the movements, rhythmic movements in our kids who are on the spectrum, we should always start with pre-birth movements. And these are the set of pre-birth movements which we have to perform. Now, swinging legs. Now, clearly each and everything has been shown. The hands, the word itself demonstrate where the movements have to be done. Pre-birth leg movements. Here the movements are only at the legs. No other portion of the body should be moved. The child should lie down in the supine. The hand should be relaxed like this. In the swinging legs, you fold your legs like this. Just fold your legs like this. And then you have to move one side, you have to move other side. One side, other side. Now it appears to be very, very simple. There is nothing new in these movements. They are very simple. Again, the concept is exactness. The 9 characteristics of these movements should be present. It should not be like this. Now it may become, it may become a game for the kid. Initially, you might be doing these movements of the legs with the child. Then again, he will be thinking, okay, I can also do it. He may be doing like this. No, that will not give us the results. Here we have to do rhythmic movements very slow, or maybe you can do it even for just 1 to 2 seconds, but exactness. The degree, the exactness in which you are doing, forget about the degree, but the effort, the smoothness, the rhythmicity should be there in every move. That is why it will not come initially. You may do up to 10 to 20 movements. Then after a certain time, you will realize that this much pressure is required for my child to perform this movement. Sometimes you might be giving too hard. Sometimes you're giving too push. Sometimes you may be giving too less. Suppose you are giving the right movement. It may go a little faster. The left movement may come a little lower. So that thing will be worked out only when you practice again and again with your child. So after a set of 10 to 20 movements repeatedly, you will attain that feel that yes, this is the pressure, this is the degree of movement, this is the movement I have to give to my child. And then only you will attain the, I would say, rhythmicity or the exactness. Because at a certain point of time, you will realize that yes, this is the exactness which I am attaining my child, because you will feel there the child is comfortable. There is no effort from my side. It is just going like an involuntary movement as though I am sleeping and the movements are being performed. So that is what. So, and this concept should be applied in every movement. So these are the first are swinging legs movement. Then you have half frog leg. In half frog leg movements, again, it's very clear in the, the diagrams. So you have to just make your position of the legs like this. One left leg should be crossed, half cross like legs. Then you make them straight and then you do the right leg. This is the one step. This is the one complete movement. Similarly, you perform the second round of movement like this. So this is the order in which these movements have to perform. These are the frog leg movements. Then you have the up and down movements. Now these movements are pre-birth movement again to integrate the FPR and Moro. So, and since it is present, I am this again and again stressing Moro and FPR invariably will be present in more than 90% of kids who are on the spectrum. So we should always start our rhythmic movement concept therapy with these pre-birth movements. Up and down legs. Legs should be straight, then you flex them. These all movements have to be done by you. The child need not have to done because we are doing passive movement. Passive means instructor is doing the child movements on the child. Then you have to make them relaxed down. Now, how to hold them, at what angle I have to hold them, that is not important. You can hold them either with his sole, you can hold them either with your knees. That is not important. Important is the rhythmicity, the pressure, and how much movements and how smooth and how rhythmical you are doing. It should not be like this. One movement of the leg, you raised it at that point. Second leg, you are moving at this point. No, that is important. It should be symmetrical and rhythmical and effortless. Then we do the crossover legs. In crossover legs, the child again is lying down. He's just crossing over the legs, then open, then cross legs. Now here, cross legs here. Suppose these are the two legs which I am having. So one you will cross like this, then open. This is the first step. You are keeping your hands like this or legs. You cross it over, then you keep it down. Then you cross the other leg over, you keep it down. It should be crossed. It should not be over. It should be crossed. As see in this third picture, it is crossed, then you keep it down. So this will complete our first set of movements of crossover legs. Then we can start again with the second set. Then you come other. So these are the pre-birth leg movements. Then we come to the pre-birth arm movements. In arm movements, over the head arm stretch, you just have to keep your arms here. You stretch, keep your hands here. You stretch, keep your hands here. You stretch, keep your hands here. So these are, so again, I'm telling movements are very, very simple. Exactness is important. If you tell your child to perform, those children who are good imitation, those who can perform action imitations very well, they can do these movements. But that exactness and smoothness will not be there. That is why passive movements are important in our kids. Since we are working with the kids, so it is important. If we are dealing with an adult spectrum kid who is mild to moderate, but has good imitations, good understanding, then they can be performed actively. Then you have pre-birth movements, chest to ear. So you have again keep your points. Now this where you have to keep, this is the K27 point. So keep your hand here, keep your hand back, keep your hand here. Keep your hand back, keep your hand here. Keep your hand back, keep your hand here. Then you have forearm lift movements. Again, forearm lift movement is how we are performing. We are keeping all the arm movement should be begin with the hand at the collarbone. You have to keep your hands open, hands down. You keep it like this, flex it like this. Keep the hands down, bottom hand. You are initially flexing. Suppose this is my hand, I'm flexing it, then I'm keeping them down. Then you bring it here, then close it. So each and every step is very clearly demonstrated in all these movements. Then up and down movements, again, you have to keep your hands up, bring down, hands up, bring down. In and out arms, keep your hand like this, keep your arm. Now, you will be surprised that most of the times when we do exercises, PT classes going on, or in schools, many of the kids are performing these movements. So these movements are nothing new, but they have a very, very important concept of integrating these primitive reflexes like FPR. But here, again, we are working with the kids who are in the spectrum. So it is not for the physical activity or for the PT class, it is for the integration of the reflexes. That is why exactness, rhythmicity, all those 8 characteristics are very, very important. Now, forearm lift, I have shown you up and down, in and out arm, crossover legs. Again, start with the K points, cross it, begin at the K point, cross it, begin at the K points. Head bob. Now, head bob can be 2 types. It can be side to side, it can be up and down, or it can be like this. So again, one ear is there. This is up and down. This is side to side. This is side to side. And one is head to shoulder. Now, in those kids who have an activated TLR, or even myself, if I compare, I'm finding it difficult to perform these exercises. Probably my TLR might be activated. Why? Because of continuous sedentary lifestyle, we might be having spondylosis issues, backache problems. So in that case, our neck might be stiff. We might be not be able to perform this neck movement so smoothly because our TLR might be activated. Because any movements which we are doing at neck, if we find it difficult, then definitely our TLR is active or it is not integrated. So that is why I was telling, it doesn't mean that uh, this TLR will be active only in a child who is on the spectrum. Even as a neurotypical person or even in any adult who has a sedentary lifestyle, because of spondylosis issues, backache issues, the TLR will be active. And because of that, he may not be able to perform these rhythmic movements. So these movements will be helpful. And logically also, when somebody is having any neck issues, we could tell them, or even physiotherapists also tell them, you have cervical, you perform these activities, these neck movements, it will become better, unless and until it is very acute pain is there. Because in acute pain, we don't perform these exercises. But in kids, there is no issue of the cervical and etc. So there is no issue of acute pain. Here we are doing with a different concept of integrating. Now, one thing you have to remember, don't perform any neck movements in children who are on the Down syndrome. Any children who is on the Down syndromes, don't perform this neck movements. Why? Because in Down kids who are in Down syndrome kids, the first three cervical vertebrae means the neck vertebrae. Neck vertebra means the spine we have, they have small bones are there. So the first three bones are very weak in children who are on Down syndrome. So they can cause the dislocation or might shifting of these bones. So never perform any neck movement in children who are on the Down syndrome. This is a very important caution while performing these movements. So then you have head and shoulder, you turn like this. The body should not move. It should be just, you have to bend like this, you have to bend like this. So it will be initially difficult because of those issues which we have discussed. Then we have, so till now we have discussed about the leg, the arm movements, then you have the head movements, and then you have these other movements. Now these other movements, frog leg, overhead, these are additional movements. So again, it's not important that we have to perform each and every movement. Now if somebody asks me that, sir, do we have to perform all these movements in a single day? No, I will tell you that you just start with leg exercises or you start with arm exercises. Sorry, the order in which we are doing the exercises is not important. You can either begin with the arm movements, you can begin with the head movements, you can begin with the leg movements, but don't perform all the movements of leg, arm and head at a single day or a single group. Suppose you start with the head movements. Perform head movements. There are 3 head movements which I have shown. You perform just 2 head movements. You perform it just for 2 minutes. Not a problem. You can perform even for 5 minutes depending upon ability, but it should be smooth and rhythmical. Unless and until you don't attain that smooth and rhythmicity, you are doing exercise of even in half an hour is waste. And initially that will happen. After doing 15 to 20 minutes of exercises, you will figure out and also you will learn that out of 15 to 20 minutes, I was able to perform that rhythmic movements only for 1 minute. Because the rest of the movements were either non-symmetrical, the child was not cooperating, I was not getting confident how much pressure I have to give, how much strength, how much direction, how much angle I have to give. So that is, I'm telling, do practice, keep on practicing. But out of that 15 to 20 minutes you are doing, the actual movements will be hardly of 1 or 2 minutes. And that 1 or 2 minutes will gradually keep on building and building and can land up to 15 to 20 minutes. And remember one thing, whenever we are doing this rhythmic movement exercises in a day, we should not do these rhythmic movement exercises more than 20 minutes in a day. 20 to 25 minutes is maximum. And start initially with 1 to 2 minutes, that's all. Now,
Excuse me, sir.
Yeah, please.
Sorry. Sir, how many times should we repeat? Suppose I'm doing only the leg exercises. How many times should we repeat that movement?
I will tell you that, I will tell you, there is a point which will give us an indication. Now you don't have to perform the movements beyond that. Okay. So that point you will judge in your child. We will be coming in our future slides. So these are the pre-birth movements. So do all movements slowly. Again and again, I'm stressing, more is not important, less is important. And if we do less movements, we will be able to attain that 9 characteristics of a rhythmic movement. If we are able to attain that, we are doing the right for our kids. We are doing the right rhythmic movement therapy. Now, if we are doing wrong, nothing will harm the child. As of now, nothing will cause harm, but you will not attain the results. That is the only drawback. And that is why we tell, initially it will take you time. It may take 4 months, 5 months, 6 months, but once you get that confidence, it's just the beginning. You need an initiation in the body to get that. Once it's done, you will get the improvements on regular basis. So don't do all movements slowly. And if it is challenging to get the movements to be slow, rhythmic, coordinated, imagine doing them in water. This is a very good thing. Now, just imagine the swinging legs. You do yourself. You take a tub of water and you put your legs in it, and then you perform these swinging leg movements. You will feel how smoothly and how effortlessly those movements are being performed. Exactly that feel you have to give to your child when you are doing that. So it's always advised that whenever you are doing the movements on a child, because you are also new, you are also learning, and even when I or any other person who learns, we perform initially doing it on a water, so that we get that feel, we get that rhythmicity in our body, so that we can perform and transfer that rhythmicity to our kids. Because kids won't be able to do that movement by keeping their legs in water. We have to initially feel that thing, then perform those movements. So you may start only with head movements or arm movement, leg movement. The order does not matter. That exactly I was telling. So important thing is rhythmicity and concept of, the symmetricity. So how you can perform these movements? You can perform either 1 or 2 movements, or you can perform 2 movements or 1 movement. That is not important. Important is the duration. Important is the rhythmicity and the symmetrical pattern. So passive movement. Now, what is that purpose of this passive movement? Why we are doing this passive movements on our kid? The basic concept is we are integrating the reflexes, especially the FPR and Moro. And we know that from the Moro only, the rest of the reflexes of the newborn comes. So if we are, and before the Moro is the FPR. If we directly work on the Moro, we don't work on the FPR, then we will not be able to justify our movements. So if we work on the FPR, and FPR and Moro, they are basically both a similar function. It's just a modified version of FPR is Moro, and modified version of Moro is adult Strauss reflex. So basically, when we perform this movement, pre-birth movements, we are actually invariably working on Moro and FPR. So when we do that, obviously, I have told you, it gives you a defensive mechanism. It's a reflex which keeps us tell that yes, I'm safe, I'm not safe. So it gives you a feeling of safety and calmness. Means to say, please kindly mute yourself. Please make sure that you are always on a mute, because this is a very important workshop for today. And because while doing these exercises, we should also know why we are doing it. So these passive movements, as I have told, it's basically pre-birth movement, especially is for FPR and Moro. And FPR and Moro are concerned with our limbic system. Limbic system means which helps in safety, emotions, regulation, thoughts, and learning. So it gives you a sense of feeling. So that is why it is basically helping through stimulating the brainstem. So it develops awareness of the body part, develops coordination, improves postural alignment, improves attention. So if we are able to perform all those movements, we may able to integrate the reflexes of FPR and Moro. Then automatically our future reflexes might also get integrated. And as a result, we might self-improvement, especially the improvement which we might feel, especially in anxiety, the confidence issues, and all those factors which we see in our kids as a result of fear or anxiety. Now, so those were the pre-birth passive movements. Now, these are the passive movements after birth. Means here we are doing the movements which are basically being done for the integration of the primitive reflexes. So pre-birth passive movements were the movements which were being done to integrate the FPR and partly Moro. Now, these passive movements are the movements which are basically being done to integrate the primitive reflexes which are present after birth, like ETNR, STNR, and etc. etc. So there are basically, the number has been given, movement 1, movement 2. So there are in total approximately 17 movements. Now, 17 movements we don't have to do. We have to focus on passive movements. 17 movements include passive movements and active movements. But as I have told, we are concerned with the passive movements in our kids. So we have to perform these passive movements. Now, first movement is straight leg rocking. You have to make the child just lie down. This is the position. It's very clear. You have to hold the kid and give the rock. Now, this is, I will show that in the videos. So this is the straight leg rocking. Then you have the knee bend rocking. Now, in knee bend rocking, basically what you are doing here, you were rocking the legs. That means this is the legs, and this is, suppose, imagine this is the, now this is the two legs, for example. I'm just rocking the legs. So I'm just holding from the, this is the direction to and fro like this. But that to and fro smithicity is very, very important. That will, because what happens, suppose you are giving three movements. One movement you give it smoothly, you go in a smooth manner, you come back in that smooth manner. But in the second movement, what you do, you give that movement and then it goes back. It will be, sometimes you give hard, sometimes you push back. Another important thing, when you give these movements should go right up to the brain. In the sense, the whole body should get that movement. It should not be only up to the leg of knee. The whole body should move. So I will show you in the video how this movement is exactly to be done. Now, this movement is the knee bend rocking movements. Knee bend means you are giving the pressure at the knee joint and giving the movements. Now, again, the whole body should be moved. It should not be only a knee should be moved, but the whole body. The here you are giving the pressure at the knee, but the whole body should. Then this is the fetal rocking position. Fetal rocking position means this is the position of the fetus. When a child is born, a newborn is born, he always remain in a flex position. If you see, they will always try to flex their hands and knees. So keep the child in this position. This is the position of the arms. One arm should be flexed, one arm should be open, hand like this, and both the knees should be flexed. And you have to, the instructor, one arm is relaxed. He's just relaxing, and the right hand she's holding. Just hold it at the buttocks and give to and fro like this. Now, other is rib cage movement. Now, this movement I generally avoid giving to the kids because here we are avoiding pressure at the ribs or the chest. So avoid giving this movement. So I always, because it's performing at the chest movement with the ribs is because sometimes we might give a hard pressure on the ribs. So the child might feel discomfort. So as a result, avoid giving this rib cage rocking movement in your kids. Other than this, we can do straight leg rocking, knee leg rocking. Now, the name itself suggests we don't have to mug up, we don't have to loop. The name itself suggests once you keep on doing again and again, you will able to understand. Straight leg movements means you are keeping the leg straight and doing the movements at the sole. Knee bend rocking means you are keeping the knee bent and giving the jerk. Fetal rocking means the position in which the child lies down. Rib cage rocking you can avoid. Then rolling bottom side to side. Arrow is there, arrow is being marked. You keep the child lie down in this position. Again, important, the position is very important. And that is why it has been demonstrated very clearly in each and every slide. So the child should lie down his hand like this. The arm, the hand, the neck should be bent. The arm should be relaxed. There should not be any bending of the knees. It should be relaxed. And you just with your one hand, just keep your hand on the buttock and keep roll like this. Just giving roll like this. Now that rolling is important. Again, it should be smooth and symmetrical. It should not be one movement is fast, other movement is slow. Now, I have taken a more clear view of this knee bend rocking movements. So again, now imagine, now this is the position of the hands which the instructor is being holding. As I was telling you, the position of the hands in which you hold doesn't matter. The thing which that matter is the movement is being originated from the level of the knee. In the leg rocking movement, straight leg rocking movement, the movement was originated from the bottom of the leg. In the knee bend rocking position, the movement is being originated from the knee position. Means from the knee you are giving the jerks. So whatever comfortable position you are able to hold the knee, you hold it. Probably when you are giving the keeping your hand on the knees like this and you are giving the movement, you may not be comfortable. You may not be able to form a firm grip on the child's knees. So you can either hold it like this in the first position. You can just give the jerk like this, or you can hold it from here, or you can hold it from the popliteal fossa. I mean, from the underarm, underneath of the knees. So position of the hand doesn't matter. Your comfortability is important and the rhythmicity is important. And the name itself suggests the knee bend means the movements are originating from the knee. So this rocking, knee bend, straight leg, it indicates the movements are being originated from there and going up to the brain. Then you have active movements. Now, active movements are not important for us. So these are the active movements that are not important for us. So I'm not going to these movements. So strengthen the connections between the cerebellum and the various areas of the cortex. This is the importance of these rhythmic movements. They lead to improve in posture, concentration, impulse control, comprehension, speech, and language. Why? Because we have discussed previously in our workshop 2 that all these movements, they help in integration on the primitive reflexes and as well as the intrauterine reflexes. If those reflexes are integrated, we will be able to develop the postural lifelong reflexes, and as a result, our CNS, the maturity system, the brain, and etc. will become better. Once those become better, we will see improvements in various parameters, though it may vary from child to child. Though one child may get better improvements in more parameters compared to another child, but definitely we might see improvement in our kids on various parameters. Now, these are sitting and kneeling movements. Now, these two movements these are the important movements which we have to do. Now, these movements are basically called as STNR. Now, I was telling you STNR. Remember that diagram of a W sitter, the W sitting posture, where the neck movements, where they are doing, the child always keeps the hands and keeps the legs in a flex position, or W sitting. Whenever he's writing, whenever he's eating, whenever he's doing something with the hands, which involve the hands, he will do a W sitting. So that W sitting means STNR is active. Now, this sitting and kneeling movements are specifically being designed for STNR movements. Now, this specially is known as STNR rocking and hands and knees movements. So these are the movements pulling forward. These are the movements which are being specially done for STNR integration. Now, this is the other. Now, this two only, movement 15 and movement 16 are for STNR integration. That is why now you can also see this position. So you don't have to again mug up, or you don't have to remember. You will gradually do the exercise. You will come to know. This is the position of the child of the W sitting. So we want to basically integrate this reflex. So this is how we'll be integrating. This is just the posture and diagram. I will show you in the video how we have to integrate. Now, again, other passive movement is this cat arches. Now here, what you have to do, here you have to just keep the child lie down in this position, and with the help of the hand, you have to just give him a pressure, arch. You have to form the arch. And in this case, you have to lift his body up. Though it may be difficult, again, I'm telling, we don't have to do each and every movement. We have to begin initially with the pre-birth movements. Even if we start with the pre-birth movements, it will take at least 3 to 4, maybe 2 to 3 months. If we do it on regular basis to attain mastery on these primitive, the pre-birth movement, because they themselves are a lot of movements. Once we attain the mastery of that, then we can go on to the passive after-birth movements. So this is the cat arch movement. The important movements here are, these are the most important movements for passive movements. The straight leg, knee rec, fetal rocking, rolling, bend to side, and STN. This STNR. Now, so in total, there are basically 1, 2, 3, 4 passive movements here. And then we have STNR2 and somersault. So total we have 5 and 3, 8 to 9 movements we have, which we have to focus and perform. So these are the passive movements to integrate the reflexes after birth. I'm not now pre-birth movements are a separate thing for intrauterine reflexes. So now first I will show you the video, and then we will discuss on the indicators, as one of the parent was asking how much we can do and what is the point which will indicate us that now we have to stop.
Excuse me, sir.
Yes.
Sir, which are the passive movements and active movements you just explained? Number 1, 2, 3, 4. You can tell us later also, but can you please tell us after pre-birth movements, which are the next ones that we go to?
After pre-birth, these are the passive movements. Movement. See, it is written passive movements. Movement 1, movement
One.
slide
Okay.
is, you are able to see the slide?
No, sir, we cannot see the slide.
Just
But I will check it. If you can just tell me, I'm noting it down.
okay. I will tell you after the presentation. Okay. Once I
Okay.
show
Okay.
the videos, I will.
Yes, sir. Okay. Thank you, sir.
Number 2, sliding on back. This is
So now these are the passive movements with the knee bend movements.
movement. Number 2, sliding on back. This is Taylor, and I put my hands here. And I push, and I...
So just kindly observe that when the instructor is pushing with the hands on the knee, that is the knee bend rocking movements, the movement is being going till the head. See, his movement is happening at the level of the head also. That much pressure of movements have to be given. Observe the symmetricity, observe the effortless of the client, observe the effortless of the instructor and how comfortable she is doing. She's talking and doing the movements. That much involuntary, that much, it means to say you should not be conscious while doing the movement. You should not feel that something is being done by you. So that effortless movements have to be done and that symmetricity should be attained. And the movement should go till the head. Whatever is the origin of the movement, it should go till the head. Observe each and everything which I am telling.
pull. And we see here, we're going to float. You see it's moving up into his head here. It's a small movement. What happens if I go too fast? Do you like that so much? Not so much. So we just need a nice, slow, steady rate in there. Alternatively, I can put my hands here.
So she has changed the position of his hands, but the origin of the movements, the rhythmicity should be same. And again, important, you might increase the, you might increase the intensity of the movement, but that will not give you any benefit because the child might not cooperate. He may not feel comfortable. So as slow as possible, you can do it. That is better. But again, rhythmicity, that 9 characteristics of those rhythmic movements are very important.
And push, or I can push there or from behind the knees. But this seems to be the best movement here. We're just going to go there until he's ready to stop. Okay, we're just going to pause there now. All right, thank you.
So this was the movement of the passive movement at the level of the knee. Now see, this is a small kid who is on the spectrum. Now exactly you will be working with your kids. Might be some kids might be bigger enough or might be very small. So this is how you have to perform these movements. See how she's holding this kid and how she's performing those movements. Again, the position is not important. From whatever comfortable you are, you can hold that position. But movements are important. Those rhythmicity is important and the child should be comfortable.
Okay. bit more. Okay. This is a good one. You like this one? And while he's still here, it tells me that
So
he
you
wants some
can
more.
can
If he
see
was-
that how much
he had
pressure
done
it
enough,
is
he
going
would
right up to his head.
probably get up and walk away. You like this one? The purple one. Okay.
Now this is another movement in a child who is on the spectrum.
Right, ready? You can bend your knees. Woo! Okay. And so we'll do this one here. I'll come from behind your knees. Oh, you don't like behind your knees. Look what happens when we touch.
So exactly these are the things which we'll observe in our kids when we do it these movements initially. See, when the instructor tried to did this movement, he was not comfortable. He start making his positions. So those different things, holding of the knees, probably you might hold the child with the knees in front. He may not be comfortable. You hold it from the down, he might be comfortable. So all those ifs and buts and different positions are we need to try, and that will initially come once we keep practicing with our kids again and again. And once we are able to get that confidence, and the child is also confident enough, he's also comfortable that yes, he's comfortable in this position, then we can perform those movements on regular basis. Initially will be tough, initially, because you also have to figure out in which position he's comfortable in performing the movements, and in which comfortable you also feel confident in attaining those 9 characteristics of those rhythmic movements.
Behind your knees. And what about if we take on top of you? Oh, there we are. So this is like sliding on the back in a passive way. You don't mind that one.
Now he's comfortable, he's very comfortable in this position, he's relaxed, he's lying down, rather than when the instructor was holding it under the knee. So when she hold it up the knee, he's comfortable. And now he's also and observe the movement, they are going right up to the head.
You gonna breathe for me? Oh, take a breath. And we'll do this a little bit more. Well done. Hey, does it... Huh? You'll be a frog again. Ah, you're gonna come up back up to here. Okay. So now it's okay to touch behind your knees, but and we can come from behind.
Now this is the STNR rock which we are doing in the kids. STNR, again, remember, it is this is the name itself suggests STNR rock. STNR means the W sitting, the problems with the kids who are on W sitting whenever they are doing any activities or movements of the neck. That means STNR is integrated. I mean, the STNR is still persistent. So this typical movement, what is known as STNR rock, is specifically to integrate the STNR reflex.
This movement is the STNR rock. I'd like you to sit back.
Just remember these, what are these points which they have told, and that exactly has to be done. That means you will get it better when you see the video, and obviously I will be sharing with these slides and materials so you can go through it also.
On your heels, then put your hands on the floor in front of you. Just find a comfortable distance for your hands. It can be close, it can be far away. Have the spine as straight as possible, and also have the head aligned, the middle of the ear in alignment with the middle of the shoulder, if at all possible. And a bit further, hands a bit further away. Boy, to come up and oh, and boy.
So note the position of the hands.
Boy.
Note the position of the hands. It should be comfortable in the midline. He should be relaxed with the knees bent, and the person, the instructor, have to give the rock from the bottom, completely from the W sitting position, to raise him up.
All right, a bit further away, you'll see his hands want to, and there we go. And if we think we're a baby, we're really getting into the position where we're ready to crawl. Oh, how's that? Excellent.
So it will be initially, it will be very, very difficult. So these STNR rocks are initially, I won't advise you to do it. You start always with the pre-birth movements, because many of the times if we are able to resolve those things, many of the issues will resolve in future. But this is specifically for STNR and specifically for those kids who are having W sitting. So in those who are having W sitting, they can directly go to this STNR rock. And if they are able to perform it efficiently, probably those things of W sitting might reduce to some extent initially. Do you want to see this video again?
This movement is the STNR. Find a comfortable distance.
Now this is another video for STNR rock. The kids by themselves are performing. You observe that how smooth and efficiently they were doing this rock. But it will not be possible for us to perform with the kids initially. So we have to do passive. Now this is the STNR rock. It will become more clear with this video.
Or rock you on hands and feet, which is what babies do when they're getting ready to start crawling. So you put your hands there, in there, and again we want those elbows to stay nice and relaxed if at all possible. Our head perhaps a little bit more like that, and you're going to bounce up, and we want to bounce back. Wee! Wee! We're keeping that spine straight. And wee! Wee! I see that it's a little bit difficult to keep your hands there. So let's see, if I put that under your hand there like that, and under there, is that more comfortable on your hands there? Yes. Right, yeah, so that perhaps it'll take the bit of strain off there on your hands. They want to cup a bit, so they, and remember, elbows nice and relaxed, breathing, whee, and bounce. Oh, you're meant to have a good time. So remember what babies are like, they bounce, whee, whee. So what we're going to do now is to move your hands a bit closer to your body there and see, and make it a smaller movement. See what that one feels like. Okay, you ready?
Mm-hmm. That feels better.
Is that easier?
That's a lot easier.
It's a lot easier. You want to do a few of those by yourself?
Sure.
Okay, go. So remember, it can be a big movement or a small movement. We still want to keep a rhythm, like a baby, and bounce if we can. Remember to breathe. It's a good thing to do. And keep your head still if you can. Do you need something to look at in the distance? Is that a bit easier if you've got something to look at? Yeah. All right, so look there. And if you like, you can even look between the two of them. All right, if I can move that closer, how's that?
Yeah, I like it closer.
A bit closer there. And is this one up here okay?
Mm-hmm.
Okay, good. Remember to breathe. Whee! Meant to have a good time. Bounce. Whee, whee, that's right. We could be a lion. You ready?
So this was the STNR rock, but this is how we have to keep the position of the kids. Again, it should not be performed at a one go initially. Initially, we have to again work with the pre-birth movements, and then gradually we have to move forward. Even when we start with the pre-birth movement, that itself will be sufficient to perform for at least 1 to 2 months, because there are a lot of pre-birth movements which have to be done. And the age category, we are dealing with the kids who are somewhere around between less than 10 or between 12 to less than 15 or 12. In those cases, more if FPR is active, we have to start with the pre-birth movements. STNR is specifically where we find W sitting. Is there a child who is 18 years or 19 years and who has a W sitting posture? In that case, we can advise and we can go for this STNR rock. So after the pre-birth movement, these are the passive movements. Slide is visible now.
Yes, sir.
So after the pre-birth movement, these are the passive movements. Movement 1, that is the straight leg rocking, knee bent rocking, which we have seen in the video. Straight leg rocking is also similar. Only thing, you are giving the movements from the leg. So this is the straight leg, then knee bend. Movement 2, then you have the movement 3. Have to keep the position in this way, and just we have to give the movements. And that's rhythmicity is very, very important. 9 characteristics. Then this is the 5th movement, rolling bottom side to side. 4th one movement we don't have to do for our kids. Then this is the position which I have explained you through the video. In whichever position you want to hold, you can hold it, but you and the client should be comfortable. Active movements are not important for us. Sitting or knee movement, that is the STNR rock. I have shown you, this is important. And these cat arches, somersault movement, these are specifically for adult, because these cat arches and somersault is not possible to perform passively. That is why when we do for passive movements, we don't do for these cat arches and somersault and even sag and arch lower back. We basically do for this STNR rock and pulling forward. Now this pulling forward is basically a part of STNR rock. As we have seen in the video, the note from where she's holding from the back and giving a pull. Now that pull is very important. It should not be sometime too hard. It should not be sometime too heavy. It should not be sometime too at a higher level. It should be at a smooth. So the best thing, you should move like this. Your arm, the position of the arm should be like this, so that you get a straight curve. Should not be like this. Should not be like this. It should be like a smooth curve. Your hand should go like a smooth curve. And that will come gradually when you perform the movements again and again with the child. Now, what are the physiological indicators of doing enough? Now, suppose you have started with the movement for your kid. We have seen all the pre-birth movement. We have seen the other birth movements. Now, you started. Suppose you started with the movement and you want to know that for how much long I have to do it. As I have told you that we can do it maximum for a period of 20 minutes in a day. That means when you are fully matured in doing those exercises and also the child is comfortable in doing it. Now, there are some things which will give you an indication that you are doing enough or you have to give a pause. What are those things? When you're performing the movements, the child maybe start doing yawning. He maybe show a facial change in color, means the skin of the face may become red. There may be redness around the ears. He may start yawning, or he may start complaining of stomachache, nausea. He may be falling asleep. Now, these things which have been marked in yellow, these are the most commonest which we observe in 90% of the kids, which will give you an indication that we have done enough. Other than this, the child may give you an indication, stop, I don't want more. Now, this thing will appear even when you do with your child on the day one, even for 1 second, because he may not be comfortable. Basically his whole structure is not coordinated. There is either maybe too much flexicity, there may too much tone increase, there may be too less tone. The joints may not be smooth, they may be rigid, because we know that the strength in the muscles may not be that much strong. So he will resist doing that. So that resistance we have to break it initially. And that resistance doesn't indicate that you have reached the physiological status of that means you have done enough. No, that is the resistance to the child. That physiological indicators, when you have done enough, will only come once you attain that rhythmicity. Unless and until you don't attain that rhythmicity, you cannot think that I have done enough. Suppose you are doing it for 20 minutes, you have done the exercise today with your child. Out of 20 minutes, I would say 17 minutes, he was distracting you, he was doing like this, he was doing like this. But that 3 minutes you did it, that was sufficient. He was comfortable. And during that 4th minute, that means during that 20th minute, he started yawning. He started yawning, or he started something dizziness, or he started feeling sleepy, or after doing the exercise, he says, Mama, I'm feeling sleepy, or he's yawning, he's having a change in facial color. So that indicates that, yes, that 4th second of doing that reflex integration exercise was enough. That means to begin with your child, that 3 seconds of rhythmic movements was sufficient enough. And practically speaking, we have seen even 2 seconds of rhythmic movement exercise is enough. Remember that 2 seconds of rhythmic movement exercises. It's not that the whole duration of 20 minutes, that doesn't matter. The 2 seconds where you actually got that rhythmicity and 9 characteristics, that was sufficient. So to means to say that initially you might get even 15 seconds, even 10 seconds might be sufficient for the child to get that, because that is the strength and effect of these physical rhythmic movements. So initially you might be getting that 2 seconds, 3 seconds, or even 4 seconds are sufficient. Then gradually after that 5th second, the child may start yawning, he may fall asleep. These are the things which you might feel nausea, redness. And gradually, once you build up, you reach a period of say 1 week, 2 weeks, 10 days. That period of physiological enough will increase from 5 seconds, 10 minutes, 15 minutes gradually. But maximum, you cannot do 15 to maximum, I would say, although they say 20 to 25 minutes, but initially, as a beginner, we should not do more than 15 minutes in a day, total exercises. Now, how many exercises you can do in a day, it is important. As we have seen pre-birth movement, there are leg movements, head movements, arm movements. Generally, I would say you can begin initially, you should begin with only 1 exercise. Suppose you are doing head movement, do it only 1 exercise or maximum 2. Then once you are comfortable, you increase the duration, and then from 1 to 2, you begin to 3. But whenever you are doing it, whether you are doing it for 15 minutes, 20 minutes of rhythmicity you have attained, do only 1, maximum 2 exercises in a day of different sets. Don't do more than that. So if any of these things happen, stop and pause, because that indicates that you have overburdened the body. Then there will be issues of nausea, vomiting, and all those things. So these are the physiological indicators which you, as an experienced person, when you do it again and again with your child, you will observe. And then that will indicate, yes, you have done enough, you do not need have to do. Sometimes what happens, you feel that, yes, now I have attained that rhythmicity, I should keep on doing. I should do it at least for 15 to 20 minutes so that I will get the results. No, you will not get the results. In fact, when you perform it next day, it will be difficult because the child will not cooperate because he had feel that stress and anxiety in his body after doing that exercise. So that thing should not happen. That is why less is more. Even doing for 2 seconds is sufficient. So the physiological responses do not lie. Learn to trust those physiological responses because these are the responses which the child is not showing, his body is showing. He may, why I'm telling you this again and again, because when you do that exercise, you do it for example, 20 minutes. Now, during that 20 minutes, you will feel that he has even in the first 1 minute of the exercise, he has attained that physiological status of doing enough because he may be rigid, he may be doing here and there, but that is not the physiological sign. That is the child is doing. So that is why physiological sign means redness in the face. Now, redness in the face, nausea, all those things child cannot show on his face. That are actually the physiological changes. So that is why those will never tell you lie, and that will gradually you will able to learn when you work with the child again and again. So start what a person is comfortable with and move from there. So again, suppose you are doing the leg movements, you are doing the straight leg movements from the sole, you are giving the movement, he is not comfortable in that. And when you do the effective knee bend movements, which we have seen in the video, he's comfortable in that. So do with that movements first, because there is no rule that you have to perform those exercises in a systematic manner, or is there any order? No, you can perform in any order, but whatever exercise you do, initially start with pre-birth movements. Pre-birth movement, you do it in any order. Then once you complete that, which will take maybe 3 months, 4 months, or even 5 months. Once you complete that, then you go to the birth movements, passive exercises. And those exercises, knee bend, straight leg, you can perform in any order, whichever the child is comfortable. So as the movements become more and more, again, the logical concept is here. We know that our children's brain is not organized, it's not mature. That is why they are confused, they are not able to think. And because of that, we will find difficulty in performing the movement. They will not be smooth and coordinated. So once we keep working with our kids again and again, that exactness, that smoothness will come. And automatically, when that exactness and smoothness will come, that will also give you an indication that the reflexes are now getting integrated. You don't have to check for anything, cross-check that now I will check whether my reflexes are integrated in my child or not. No, the improvement on those exercises, suppose you start on day 1, he is very fidgety, is not doing. And then after 3 months, you find, yeah, when I was doing that exercises on day 1, he was so rigid. And now I have done that rhythmicity movements after 3 months in such a smooth manner that I was able to perform for 10 minutes without any discomfort to my child, without any me. That means the brain is maturing because you are able to attain that coordination, that smoothness for longer duration. That means the reflexes are integrating, the connections are getting improved. So in a way, we are basically maturing our caution. As I have told you, that all neck movements should be avoided in Down syndromes, the neck movements, because of the poor cervical vertebrae, the bones. And again, important thing, seizures. That is, if any, we know that 20 to 25% of the kids who are on the spectrum, they have seizures. So seizures are generally not a contraindication for performing primitive reflex integration movements. So only contraindication for doing the rhythmic movements are the neck movements, that too in children with Down syndrome. Seizures are not a problem. Generally, we say that those children who have seizure activity, they should not do head movement down, no, it is not a contraindication. But the only thing is that you can avoid doing too much neck movements in children who are on the Downs. I mean, Downs you have to avoid, but children who are on the seizures, having seizures issues, you can do little less movements which involve the neck. So these are the temporary physiological signs of movements and reflex integration. As I was telling, you will appear. Now what happens when you are doing this physiological, these signs are something different from those signs. Those are the signs which will indicate you that you have done that exercise enough. Now it is the time to stop. That physiological sign may vary from child to child. In one child, you may get those physiological signs in 1 minute. Another child, you may get it after 2 minutes. So those children where you are getting the physiological signs at a later stage, that indicates the smoothness is getting better and better. The coordination is getting better and better. Now, These are the signs which will come temporarily during the process of doing the reflex integration exercise. Suppose you are doing the rhythmic movements from last 3 to 4 weeks. So sometimes the child will get these symptoms of skin rashes, headaches, diarrhea. Why? Because now the system is maturing. See, once you have something is disturbed, you have to uh, make him in an order. There will be initially fumblance in the system. So this is that transient fumblance which will happen in the system in our body during the process of organization from the process of reorganization. So this is transient. The child may get some cold and cough. There will be frequent history of teaching during those process of physiological movements. The duration, it's not during the activity of physiological movement, but during that period of physiological therapy which you are giving, or I would say rhythmic movement therapy which you are giving, but it is transient. It will go off. So we need not worry for this, and this doesn't indicate that we should stop the rhythmic movements. The indication which tells us to stop the rhythmic movements are these. So using those movements with RMTI for autism, as I was telling, that many of the children who are on the spectrum, they will be having FPR and Moro will be active. So as a result, it is always advised to start with these pre-birth movements. And pre-birth movements can be a good place to start, as people with autism has stuck between FPR and Moro. That exactly I was telling, that most of the kids, more than 90% of the kids on spectrum, will definitely have an active FPR and Moro. So it is always advised to start with the pre-birth movements, then move on to the after birth passive movements. Now, this is the ready rockner which I was telling you. You don't have to check for each and every reflexes. This will give you a straight idea that now these are the symptoms and these are the reflexes. Suppose a child is having ADHD. So spinal gland, TLR and STNR will be active. So if he's very aggressive, he's very anxious, suppose he's having very anxiety issues. So TLR, Moro and Babkin is active. That means you have to work on integration of these. Now, one of the parent was asking that, sir, whether a speech delay and articulation issues can be a problem and what reflex is active. The direct to give you that, if there a child is having articulation and speech issue, grasp, Babkin, suck and mooting are active. That means you have to work through these passive movements which will help in integrating the Babkin. As I was telling you, that articulation and speech definitely might be, Babkin might be active, but in such kids, definitely in these kids, FPR and Moro will also be active. So when we start with the pre-birth movements and go to the passive movements after birth, automatically, if we integrate the Moro and FPR, automatically the future reflexes will also get integrated. That is why I was telling, there is no specific movements for specific reflexes other than STNR, Moro and FPR. Or those children who have frequent episodes of asthma, the Moro is active because protection. Moro is related to protection, defense. Allergy, asthma means the immunity, the protective mechanism, the protective defense mechanism of our body is weak. So you can now correlate the logics of these reflexes with the current conditions, and you can analyze the conditions with the reflexes in your child. Then these are bedwetting. Bedwetting as spinal gland reflex. I was telling you, it is related to those who pelvic muscles, weak pelvic muscles. Because if we give a stroke, there should be a flexion on the left, if you remember. So it was related to the tonicity, the strength of the pelvic muscles. So that means bedwetting is related. Why? Because our sphincter, the uterus, I mean the uterine, pelvic muscles related to the bladder are weak. And bladder muscles, pelvic muscles are a part of those pelvic muscles. So if those are weak, they'll be a bedwetting. So we can work on the reflexes to integrate the spinal gland. So that will give us an indication. Toe walker, TLR and plantar active, plantar and Babkin. So we can work on the exercises, passive movement exercises, which help us how to integrate. So this will give you a very good idea to know that which reflexes are active in my child. And this is the list and summarization of all the reflexes which we have discussed in throughout the workshop. And these are the reflexes. What are the challenges? This is I have given you in a very simplified tabular form. And what are the movements you can perform? That is also being given. Isometric and face tapping movements are additional movements that need not be done, because that movements have to be done only by a trained person. So as a parent, that are not required. If we are able to work with those movements which we have learned in our workshop, we will be able to resolve, if not at least 40 to 50% of the issues in our kids on long term. Then again, this is the thing about the FPR, the Moro, the Babkin, how to perform, when does it emerge, what are the issues which we can face, and what are the active movements, what are the passive movements we have to do with our kids. Then this is a slide to give you a severity. This is a questionnaire. Suppose the child has difficulty in putting up buttons. So this is the scoring 0, 1, 2, 3, 4, 5. So depending upon the scoring, you will get an idea that these are the reflexes are active. Suppose the child has difficulty in shoelaces and you give it a score of 4. That means almost always. So that means his 18R brains, Babkin and TLR are active. So we have to go. You get an idea that these are the reflexes which are retained. So you have to start working on the passive movement exercises. So again, so the list is enormous. You can go through that. You can always keep it as a ready rockner with you. So this was all about the primitive reflex integration program. And now I open up to the questions. So parents now can ask the questions accordingly.
सर स्पाइनल गैलेंट के लिए कौन सी एक्सरसाइज बताइए, मैं मुझसे मिस हो रहा है.
स्पाइनल गैलेंट के वही मैं आपको बता रहा हूँ. स्पाइनल गैलेंट या स्पेसिफिक के लिए हमारे पास एक्सरसाइज नहीं. एक्सरसाइजेस वही है जो हमने पैसिव मूवमेंट्स करी. अब प्रॉब्लम ये होती है कि जब हम ये मूवमेंट्स करते हैं स्पाइनल गैलेंट के लिए, अगर आप स्पेसिफिकली हम बात करें तो जो हमारी फीटल मूवमेंट है, जो मैंने आपको दिखाया था पैसिव मूवमेंट्स में, लेग को बेंड करके. Now this is the movement.
मूवमेंट 3.
Movement 3.
सर इसकी वीडियो एक बार शो कर पाएंगे क्या?
मैम इसकी वीडियो नहीं है, इसकी वीडियो नहीं है. और अगर मेरे को वीडियो मिलेगी मैं आपके ग्रुप में एक बार डाल दूंगा, क्योंकि मेरे को उसकी वीडियो नहीं थी मेरे लैपटॉप में. द वीडियो ऑफ दिस मूवमेंट इनिशियल टू बिगिन विद, दैट इज द हाइड्रेशन. तो वो मूवमेंट, उसकी वीडियोस और साथ में अगर ये वीडियो मुझे मिली तो मैं ये भी आपको डाल दूंगा ग्रुप में, मैं आपको शेयर कर दूंगा.
ओके, थैंक यू.
Okay ma'am, the movement is the, see there is no specific thing which you have to know in all these movements. सिर्फ एक चीज हमको ध्यान रखनी है कि the video which I was showing you, the knee bend rocking movement, इसमें जो हमने movement आपको दी थी, इसमें we started with the leg. तो वही हमको पोजीशन रखना है. इसमें पोजीशन आपको ध्यान रखना है. पोजीशन हमने इसमें जो स्लाइड है इसमें वेरी क्लियर द पोजीशन इज बीइंग शोन. तो इसमें जो आपको मूवमेंट देनी है, मूवमेंट हाथ पे भी दिखा रखी है कि कहाँ पे आपको रखना है. देन यू हैव टू जस्ट गिव दैट मूवमेंट इन टू एंड फ्रो. सिमिलरली इमेजिन दिस मूवमेंट यू आर गिविंग विद द मूवमेंट ऑन द नी. सो एफर्ट एंड दैट एग्जैक्टनेस शुड बी देयर. और वो आपको बार बार करके ही पता लगता है. पोजीशन कहाँ रखना है, कैसे पोजीशन बनानी है, वो इस पिक्चर में बिल्कुल क्लियर है. तो ये इंपॉर्टेंट है. बट ग्रेजुअली इट विल टेक टाइम, maybe 1 month, maybe 15 days, once you keep on performing the movements. And one more thing to add, ki there is no specific movement for specific reflex I was telling you, other than FPR, Moro and ST. But जब हम ये movements करते हैं, suppose दो चीजें हैं. Suppose अगर आपको पता लगा कि मेरे बच्चे में Moro and FPR active नहीं, in case if he is on a just mild spectrum, उसको anxiety issues नहीं है.
Sorry to interrupt, could you?
Yeah.
Sir, could you explain in English?
Okay. Now suppose, now one thing is there, as I was telling, that there are no specific movements for specific reflexes other than STNR, FPR and Moro. Now suppose you feel that my child Moro and FPR is integrated, or if it is just mild, that is not bothering him, anxiety and other issues are not there, and you feel that other issues are there, like one of the parent has like spinal gland is not integrated, or TLR is not integrated, or other movements is not integrated. In that case, we can begin with those passive movements which we have shown. So all these movements basically will help in integrating the initial reflexes. Suppose spinal gland is not integrated, but there might be a possibility that the initial reflexes which come before spinal gland, like ATNR, amphibian, they might also not be integrated, which you are not able to pick up in your child. So when we work on these movements together, they will automatically help in integrating the reflexes naturally as they come in the hierarchy. So that is why, that is the logic, that you cannot work on a specific reflex to integrate that, because all the reflexes are integrated and related to each other, and these movements have been created in such a manner that automatically they will integrate all the reflexes in a hierarchy naturally when they come in the human beings, and they will integrate them naturally in the order in which they come. I hope I have made myself clear in this.
Yes, sir.
Thank you.
Sir, how about FPR, Moro, and STNR, sir?
So that's what I'm telling. For FPR and Moro, these are the FPR and Moro. If FPR and Moro is active, you have to start with the pre-birth movements. And logically, FPR and Moro will be active, as I've told you, in more than 80 to 90% of the kids. So it is advisable to start with the pre-birth movements initially. Now, there are so many pre-birth movements, leaving these three movements below aside because these are additional movements. So there are so many movements. So when you start with these movements, start with one movement at a time in a day, or maximum whenever, even if you are confident enough in performing the movements, don't do more than 2 movements of different parts. Suppose leg movement and neck movements, you do it not more than that. And in that also, you perform only one type of leg movement. There are 3 types of leg movements. So perform only one type of leg movement with one type of neck movement. And if you are doing leg movements of 2 different types, perform only 2 different types, don't include the neck movement. Mean to say, in total, don't do more than 2 movements in a day, whether of same type or whether of different type.
Sir, is there any reason why we need to perform only for 15 to 20 minutes?
Yeah, the reason is that what I was telling, that if you go beyond that, those physiological signs will appear in the child, and that will give a problem. And as a result, that it will, rather than causing a benefit, it will cause harm. Harm in the sense, the child will not be able to perform the movements again in a better way. He may be conscious, he may not be comfortable enough, he may feel I may get those symptoms again. So rather than getting those symptoms again in the child, that gives you an indication or endpoint that movements are enough. Or another important, from technical and rhythmic point of view, you are overstimulating the system. See, anything under stimulation, overstimulation is always harmful. It's just like a child who is sitting like a norm, he doesn't talk at all, he's just sitting completely, he's not disturbing, and a child who is very hyperactive. So both the spectrum of the kids are wrong. That is why you have to keep a balance between the excitability and inhibition. So that is why 15 to 20 minutes is the time which has been taken through the studies and through their programs, which is considered to be a balanced state between overstimulation and understimulation.
So suppose if I am doing this actions for 15 to 20 minutes in home, and if I'm sending to OT, occupational therapy, so if some kind of activity similar to this happens over there, will it affect my child?
See, OT, some sort of activity is a totally vague term. Some sort of activity, I was telling, if you do a normal exercises, that will also be some sort of activity. Here, the concept is rhythmicity and that 9 characteristics. And that those 9 characteristics you will not attain in your OT unless and until he's trained in that rhythmic movements. And if he's trained in that, he will specifically tell you, sir, I am doing rhythmic movement therapy with you. Okay.
Yes,
Sir,
sir. Thank you.
Thank you.
Sir, it seems to be a very comprehensive and detailed program. And I think it is difficult to do these movements without professional guidance. So, because it requires that exactness.
No. One thing I will tell. See, the concept of this workshop, it was in detail. It was started from A, and the reason why, because we should know that why we are doing it, what is the benefit and everything, and before doing that, why these reflexes are important. Now, regarding your point that it is difficult, initially it will be difficult. Even when I learned this, it will be difficult for me. But when you will, it will not cause any harm. One thing is there, it will not cause any harm. Other than this, the child will resist you.
Yeah.
One thing is there that will see, it's not like something medication which I'm telling you to give and if you give it without knowing, it can cause harm. These movements will not cause any harm at all. Even on routine basis, we can do this movement, but the thing is, you will get the benefits only when you are able to attain that 9 characteristics, and that will be, you will be able to attain only when you perform these movements again. And why am I stressing you to learn this? Because you cannot be dependent upon therapy lifelong. Ultimately, one day or the other, you have to become the therapist for your child. So why not as early as possible?
Yeah.
So that is the thing. You initially, it will be tough, no doubt. You have to see the slides again and again. You have to see the view again and again. But once you are confident, maybe it may take 1 month, maybe it may take 2 months. Once you are confident, you will be able to do those movements, and you will see the benefits in your child.
So, sir, can we do like that? If I try some movement with my son, and can I record the video and send it to you for just to know that whether I'm doing it correctly or not?
Yes, you can do it. You can do it. You can whenever you feel see that you require a just a cross check that I'm not doing it correctly, you can always do it. And also we will be sharing you the videos also. There'll be videos for you for 1 week access. Now that is up to you, where you can download it, you can store it, whatever you want to do, but the access will be for 1 week. So now it's up to your challenge how you can keep it in your laptop or mobile.
No,
Okay.
that will be a huge help. Thank you so much, sir.
So the videos will be the whole lecture videos, the whole webinar which we have given, it will be given for 1 week access starting from tomorrow. Then that the rest of it goes into the hands of the parents, how they can capture.
Okay. Thank you so much, sir.
Thank you.
हेलो सर, मैंने अपनी बेटी के लिए जो इससे सीखा कि मोरो प्रेजेंट है, उसमें एफपीआर भी है, एटीएनआर एसटीएनआर है, बट एक प्रॉब्लम का मुझे सॉल्यूशन नजर नहीं आ रहा है, दैट इज उसको सीवियर माउथिंग है, ऑलवेज थंब सकिंग करती है. इसके लिए कौन सा रिफ्लेक्स रिस्पॉन्सिबल है एंड उसके लिए क्या करना है?
उसके लिए आपका जो रिफ्लेक्स रिस्पॉन्सिबल है मैम, वो है एक तो बैककिन.
ओके,
ठीक है. दूसरी चीज ये है, बच्चा वर्बल है नॉन वर्बल है?
लिटिल बिट वर्बल.
लिटिल बिट वर्बल. दूसरी एक चीज हो सकती है ओरोमोटर इश्यूज. उसको ओरोमोटर सेंसरी सिस्टम में भी बहुत ज्यादा डिस्टर्ब. ये तो एक बात ये है, क्योंकि ये हम रिदमिक पॉइंट ऑफ व्यू से बात कर रहे हैं, तो रिदमिक पॉइंट ऑफ व्यू से अगर मैं बात करूं, उसका बैककिन एक्टिव होगा. और बैककिन क्यों एक्टिव है? क्योंकि मोरो और एफपीआर एक्टिव. अगर मोरो और एफपीआर उसके इंटीग्रेट हो जाएंगे तो ऑटोमेटिकली जो आगे के रिफ्लेक्सेस होंगे, जैसे बैककिन अगर इसका एक्टिव है, वो भी इंटीग्रेट हो जाएगा. तो अगर आज हम रिदमिक मूवमेंट थेरेपी के पॉइंट ऑफ व्यू से बात करते हैं, तो जो आपका जो सवाल है कि बच्चे की माउथिंग बहुत है, तो उसका इंडिकेशन है कि उसका बैककिन एक्टिव है. और बैककिन इंटीग्रेट क्यों नहीं हुआ? क्योंकि जो प्रीवियस एफपीआर और मोरो है वो नहीं इंटीग्रेट हुआ, तो आगे के तरफ इंटीग्रेट हो ही नहीं सकते. हो सकता है उसके साथ अलोंग विद दैट उसके छोटे मोटे लाइक टीएलआर एसटीएनआर वो भी शायद थोड़े बहुत एक्टिव हो, थोड़े बहुत, जरूरी नहीं है कि सारे ही, बट थोड़े बहुत. बट माउथिंग इशू बहुत ज्यादा है, स्पीच डिले है, तो दैट मीन बैककिन तो उसका बहुत स्ट्रांगली एक्टिव. सो आपको कैसे काम करना है? यू स्टार्ट विद द प्री बर्थ मूवमेंट्स. जब आपने प्री बर्थ मूवमेंट से काम करना शुरू करेंगे, आपका मोरो और एफपीआर एक्टिव इंटीग्रेट होना शुरू होगा. आपको वो चीजें दिखेंगी, जैसे कि आप बता रहे हो मेरे बच्चे में एफपीआर और मोरो एक्टिव है, क्योंकि आपने कुछ चीजें देखी जो हमने पढ़ी. अब जब आप उसको इंटीग्रेट करना शुरू करेंगे, तो आप देखेंगे वो चीजें धीरे धीरे बच्चे में खत्म हो रही है या कम हो रही है. वो इंडिकेट करेगा कि मेरे बच्चे में एफपीआर और मोरो नाउ इट इज गेटिंग इंटीग्रेटेड. अब अगर वो इंटीग्रेट शुरू होना होगा, तो ऑटोमेटिकली बैककिन भी आपका धीरे धीरे इंटीग्रेट होना शुरू होगा. तो उससे आपकी जो माउथिंग एंड अदर इश्यूज हैं वो भी धीरे धीरे कम.
दैट मींस बैककिन्स के लिए कोई अलग से काम करने की जरूरत नहीं है, एफपीआर मोरो पे काम होगा तो वो
काम होगा. और साथ में आप जो पैसिव मूवमेंट्स हैं, जो हमने बाद में पढ़ा कि आफ्टर पैसिव मूवमेंट्स आफ्टर बर्थ, उन पे हम काम करें. इसके साथ साथ एक चीज और, आपको उसका ओरोमोटर सेंसरी सिस्टम भी देखना पड़ेगा, जैसे कि उसका सकिंग है, चूइंग है, ब्लोइंग है, स्पिटिंग है, या ब्रशिंग में इश्यूज हैं, वो चीजें. टंग मूवमेंट कितनी है,
इन सारी चीजों पे मैं काम कर रही हूँ पिछले 1 साल से, ओरोमोटर जो ये है.
तो बस आप उस पे काम करिए, साथ में ये जो चीजें बताई हैं इन पे काम करते रहिए.
ओके, थैंक यू सर.
ओके.
Sir, I have a question.
Yeah, please.
Sir, like you said that we can start with pre-birth movements for oro and motor. Sorry, for Moro
Moro
and
FPR.
FPR. So you said that we can start it with initial 1 to 2 months of therapy with the pre-birth movements and then move on to the passive movements. So sir, once we move to the passive movements, do we still continue with the pre-birth movements and the passive movements, or we just move on to the passive movements later on?
See, once you...
I'm confused, sorry.
See, yeah, pre-birth movements are being done to integrate FPR and Moro. Okay?
Right.
Now, once your FPR and Moro is integrated,
okay,
then you can move on to the passive afterbirth movements. Now, the thing is, practically, one or the other, 1 to 2% of Moro and FPR will always retain there in our kids' lifelong. It will retain sometime, or maybe it may get resolved. See, the thing is, that is for sure, we cannot bring our kid into the neurotypical spectrum. Our idea is to make them as close as possible to our neurotypical spectrum. See, suppose this is a neurodiverse spectrum, and I don't use a autism, I use neurodiverse. This is the neurodiverse spectrum. This is the neurotypical spectrum. Now the gap is this much. Now, by doing all those therapies which you are giving time, which we are doing, everything which we are working for the kids, we are trying to bring that gap or the bridge as close as possible. But it is practically impossible, practically, I'm telling practically, to bring the child into the neurotypical spectrum. Because one or the something will definitely be there, because it's not a disease, it's just the brain system is such that. So we are not here to put the child, we are here to make him socially independent and carry out his activities and other things. Those independent decision making he can done in his life, so that he can stand and live independently. So that is why I'm telling that 1 to 2%, even if it is left, that will not bother us. So once you work with the pre-birth movements and you feel the majority of the issues which are related to Moro and FPR have gone, then you move on to the then you move on to the passive afterbirth.
Okay, sir. Thank you, sir.
Thank you.
सर प्री बर्थ के लिए कोई टाइम लिमिट होगी कि हमें 1 साल के लिए करना है या 2 साल के लिए? इम्प्रूवमेंट नजर आएगी तो हमें उसे स्टॉप करना है?
इम्प्रूवमेंट नजर आती है तो हम धीरे धीरे उनको कम कर सकते हैं और आगे नेक्स्ट पे कर सकते हैं, बट अगेन हमको 2 या 3 से ज्यादा मूवमेंट्स नहीं करते इन अ डे। उसमें आप कैसे कर सकते हैं, उसमें एक तरीका है। सपोज आपको पता लगा कि मेरे बच्चे में FPR एंड मोरो की इंप्रूवमेंट्स आनी शुरू हो गई, अब मैं आगे के रिफ्लेक्सेस पे काम करता हूँ। फर्स्ट थिंग तो ये है कि ऑटोमेटिकली अगर हमारे मोरो एंड FPR हो गई तो आगे के भी कुछ हद तक बेटर हो जाएंगे। 100% इंटीग्रेट नहीं होंगे, वो हमको एक्टिव पैसिव आफ्टर बर्थ मूवमेंट्स पे काम करते हैं। तो जब हमको लगा कि हमारे बच्चे आवर किड्स FPR एंड मोरो हैज बीन इंटीग्रेटेड, सो व्हाट यू कैन डू, you start doing these movements in different sets. Mean to say, suppose today you did the leg movements, then tomorrow you do one active set of movements, then next day you do another set of pre-birth movements, then next day you do another set of passive movements after birth, because you are working on the Moro reflexes and along with that other reflexes which are coming next. So here also you are using different movements on different days, but what you are doing only 1 to 2 movements on a single. That is important. There is no order. In whichever order you do, that doesn't matter. But the thing which matters is not more than 2 to 3 movements in a day, and rhythmicity, and that 9 characteristics cycle. And to keep a check of physiological pause when you have to stop, that is enough has been done.
Yeah. Okay. Thank you.
Thank you.
Dr. Lalit, I have a question.
Yeah, please.
Sir, we are trying to understand this concept. This is all new for us. So if we still have any queries, sir, is there a way we can reach out to you through email, or how do we get an appointment with you if we have any questions or concerns about our child?
You can always drop us an email. You can always drop us an email at gigglesclinics@gmail.com. And also you can also get connected to us through WhatsApp. In the group which we have created for this workshop, we will share you the details how you can get connected.
Okay. Thank you, sir.
Thank you. So I think now we can close up the session, and it was a I hope very enlightening session for all of us. I also learned a lot of things from you through discussion and questions, and also you must have also learned something new through this workshop. So I have tried to make it as simple and as detailed for each of us, and hopefully I was able to accomplish my job in this workshop, and for you, you must also got some benefit from this workshop. So thank you everyone. Thank you for joining this workshop, and have a good day. Good night. Take care of. Thank you.
Thank you so much, sir.
Thank you.
Thank you. Thank you.